It's the next big part of the Affordable Care Act. The health insurance marketplace will be available for Americans to use next week. Nan Foster Riley works in the Kansas City Regional Office for the Centers for Medicare and Medicaid Services. Welcome to the show.
Thanks for having me, Michelle.
I know a lot of folks out there are kind of confused. It's a lot to wrap their brain around. So you're here to break it down and help all our viewers out there. Let's start at the beginning.
Right.
Now, what is the health insurance marketplace?
Well, first of all, about 15% of all Americans are uninsured. In Kansas, that's like 326,000 people. In Missouri, almost 800,000, so it's very important. October 1st, just 5 days away, a whole new way to shop for health insurance will be available, and quality affordable health insurance will be available for all of these people who have been uninsured. They can go to one place, get easy to understand information, and make apples to apples comparisons, and then make their choice among private health plans. These private health plans have to cover a comprehensive set of benefits, and also families and individuals might get a break on costs.
So they need to be aware of what is available to them.
Absolutely.
Now, in terms of folks, there are a lot of people that were maybe not eligible. They had a pre-existing condition that could be eligible for this kind of insurance. Talk about the differences there.
That's absolutely right. The Affordable Care Act will ban the denying people coverage if they have pre-existing conditions. They won't be able to impose lifetime limits. So all of those things go away. So a lot of people who were priced out of the market or just simply couldn't get coverage at all will be able to get coverage in the marketplace.
And this is something that is so exciting because it's scary when you don't have insurance for yourself and your children, or you're self-employed and you can't afford it. So now you have an opportunity. Is it affordable?
Yes, we released some information yesterday about average premiums. The actual premiums and plans will be on our website October 1st, but we're seeing that the premiums are coming in on average about 16% lower than what some of the projections were.
Wow.
And something like 60% of people who are eligible may be able to get one plan or another for around $100. We're actually seeing premiums that might be as low as your cell phone bill. So it's very important, and I'd love to tell people how to get help.
That's fantastic. Do you think that folks out there are surprised by how easy the process is and how little it costs to get that coverage?
I think there's been a lot of information out there, and people will be surprised, and I hope pleased at the affordability of insurance. For some people, insurance just has not been affordable. And in addition to the competition driving premiums down, there's also help for families who are between 100 and 400% of the poverty level. They'll be able to get help with their premiums. So, for instance, a family of four between about $23,000 and about $94,000 in household income will get help on their premiums to make them more affordable. And people who have about 250% of the poverty level or less as their household income, they'll be able to get help with cost sharing, like premiums or not premiums, but deductibles and copays. So there's a lot of help to make it affordable. The premiums are pretty affordable anyway, but then there's a lot of help for people who need a little bit more. So this is really a good safety net for the middle class.
Now, this is October 1st is when you can sign up. What's next after that?
Okay. Well, first of all, October 1st is the opening of the marketplace, and it's not a deadline. It's not the end. There is a 6-month open enrollment period during the first year. So there's 6 months between October 1st and March 31st in order to sign up. In subsequent years, it will be a shorter open enrollment period. It's also important for people to remember that if they already have Medicare or they already have coverage through their employer, they don't need to shop in the marketplace. They already have good coverage. But what's next for people who would like to shop in the marketplace? We like to tell people they can get help online, on the phone, or in person. Our healthcare.gov website is the online location for the marketplace. Our call center, that's 1-800-318-2596, and I know you'll have that on your website as well. That call center is open 24 hours a day, 7 days a week to help answer questions and help people navigate the process. And then finally, we're putting together a network of certified organizations that can help people through the process if they just want to talk to someone in person. And they can go to healthcare.gov and find that local help by searching by zip code.
Thank you so much. Great information, and I know a lot to get out there. All right, if you'd like to see the segment again or check out the website or just make a phone call, we have all that information at kclive.tv later on today. Thanks so much for joining us.
Thank you.
Well,